Hi, I'm Dr. Emanuel, the President of the Medical Society of the District of Columbia. Welcome to Washington Healthcare on Wednesday, also known as WOW, MSDC weekly program devoted to informing and connecting Washington, the DC community, and others. On this section of WOW, we bring you Pride. Well, what is Pride? According to Wikipedia, and I read, gay pride or LGBT pride is the promotion of the self-affirmation, dignity, equality, and increased visibility of lesbian, gay, bisexual, and transgender people as a social group. Pride, as opposed to shame and social stigma, is the predominant outlook that bolsters most LGBT rights movement. Why is this important to feature Pride on WOW? Well, it's Pride Month. And it's no secret that access to healthcare is far too difficult for too many people. And this is often especially true for those who aren't heterosexual or cisgender. My hope is to show DC's support for the LGBT community, LGBTQ plus community, and why it's important to advocate for their health. Today, we have Nicolas Leighton, a medical student at George Washington University School of Medicine, Health Sciences. Welcome, Nick. Can you tell us a little about yourself?
Yes, thank you very much for having me, Dr. Emanuel. So as you said, I'm a third-year medical student here in DC at George Washington University School of Medicine and Health Sciences. I was born and raised in Southern California and then graduated from Northwestern with a degree in medical anthropology. I wrote an honors thesis called Is Health a Choice or Is it Chance? Looking at social determinants of health. And ever since then, I've been very much interested in promoting health system reform and addressing health disparities. I worked in Chicago in a variety of nonprofit organizations. Then I moved here to DC to work more into the health policy space with different organizations specializing in federal health policy. And that was before medical school. And since medical school, I've continued the health policy, working closely with the AMA. And I have also become heavily involved in the plastics and reconstructive field, particularly looking at transgender and gender diverse, gender affirming care.
Thank you. Okay, now, from a generational point of view, what does Pride Month mean to you?
So I kind of wrestled with this question because my initial reaction to it was to talk about how much I love celebrating the authenticity of the LGBTQ community and just the authenticity of queer people and their identities. But I think this past year has just been a little bit different where I don't feel as comfortable answering that question. I think between COVID and especially a year ago, thinking of where we were, the Black Lives Matter movement kind of cascaded into Pride Month. And between that and also COVID canceling all the parades, the parties, the corporate ads, I think there was a moment where we got to reevaluate what Pride Month meant to us. And I think Pride Month in that a year ago turned into Black Lives Matter protests carrying signs with Black Trans Lives Matter. And even here in DC, the Human Rights Campaign, they plastered on the side of their building a huge banner that said Black Trans Lives Matter instead of their regular just rainbow flag. And speaking of the rainbow flag, that has slowly, especially here in DC, it's been slowly replaced by the progress flag, which I, sport on my white coat, which includes black, brown, pink, blue, and white to represent the marginalized communities that have always been a part of our community, but have continued to be pushed aside by certain members of our community. So I think what it has grown into over this past year is remembering that we would never have pride, we would never have had pride without trans women of color, particularly like Marsha P. Johnson and Sylvia Rivera in the early days of the movement. But unfortunately, the gay rights movement left the transgender community aside. And especially after this past year of an assault on the marginalized, transgender and gender diverse community, I think we've really seen this reckoning that we should recenter Pride on the most vulnerable members of our community. And I think it was a reckoning that was long overdue, and I think it was far too late. And myself, I had to educate myself a lot, but I think now what Pride means to me is continuing to recenter the conversation on the marginalized members of our community that we need to uplift and celebrate in order to have equality for all of us, not just some of us.
Okay, that was a shift from the celebration of let's say that you're here, that you're dignified, you seek equality, to more of a political side. Is there still that? Is the community still celebrating that life, celebrating excitement, celebrating change?
Yes, I think that's always, I think that will always be a very vibrant part of what Pride means. Is it's a celebration of where we are, what we're able to do. But I think to think of it as just that, I think it will always take away from what Pride should always be about. It's not a party. It was not originally a party. It was a protest. And inherently, the Pride movement is incredibly political, and it should always be that. It should always be a political fight, fighting for underrepresented people that don't feel like they have a voice. So the parties and the rainbow flags and the parades and the corporate ads are all great, but it should always come back to the central meaning of what Pride is.
Well, thank you for that. I think many of the listeners may not have understood that it also is a political movement, not just celebration and parties and corporate sponsorship. So with that, let's move into this question. Although much have changed medically for the LGBT community, where do you see the gaps?
Yeah.
As a medical student, where do you see that?
I think a couple things. I think there's, well, first of all, I commend you because I think when we talk about LGBTQ health, it's important to differentiate the LGBT sexual orientation side of the community from the gender identity and gender expression part of our community, the transgender and gender diverse, because I think the needs of each one of those communities are very different. So distinguishing them is just helpful for this conversation. But I think, I had a patient yesterday, actually, I was working with him in our clinic, and there are certain signals, I think, that perpetuate stigma against the gay community. I was working with this patient and I was doing his chart, and one of the ICD-10 codes that he had was the high-risk homosexual behavior. And, I understand that that's for billing purposes, but I think that we should all try to have a lens to reevaluate some things that we just accept as true. Because for me, as a gay medical student, entering that code in for the diagnosis of somebody who, was completely healthy just felt a little misleading. And in addition to that, I think that we should also re-examine from a policy perspective, because that I love policy, the gay blood ban, because even just yesterday, Canada's blood donation agency said that by the end of this year that they were going to reevaluate. So they were going to send in a proposal to reevaluate the ban on men who have sex with men from donating blood, which would be a huge, which would be a huge victory, I think. Even just working in some of the hospitals here in DC, I get regularly bombarded by emails and signs saying, hey, if you have a few seconds, we're low on blood, shortage right now. If you just have a little bit of time, just come down to the basement and donate some blood because it really helped the hospital. And I've been approached and I can't. So I think that reevaluating that and moving maybe from sexual orientation to more health, sex behaviors would be beneficial to reduce the stigma against, particularly in this sense, the gay community.
Well, so thank you for that. I'll liken it to this. I think when people think institutional bias, they think race or gender.
Yeah.
I would say this is an institutional bias set up by the system and not recognizing as we've advanced how the system of bias still persists.
Yeah.
I think people, whether they're heterosexual, homosexual, have risky sexual behavior. To identify or pinpoint it to one community or one group of people is where the bias exists. Unconscious bias, sometimes conscious bias. Okay, thank you for that. Well, I'm going to move into another question. From the standpoint of transgender health, can you provide some insight in the phrase, the broken arm syndrome?
Yes. So there's a common phrase called the trans broken arm syndrome, where transgender and gender diverse patients will come into the ER with a broken arm. And the first thing that providers will ask them is about their gender identity, what hormones they're taking, what their surgical history has been. And they're just coming in for a broken arm. And it's very frustrating for transgender and gender diverse patients to enter a healthcare space seeking particular care on something that we just would not even think twice about if it were a cisgendered person, that their care is delayed because of the notion of their gender identity and different hormones, and providers will be drawn to that rather than addressing the immediate chief complaint.
Has it caused, that you know of, barriers to care?
Absolutely, it's perpetuated that. This community has been historically discriminated against by the medical community. Our field has entrenched the members of this community behind so much stigma that there's delays to care in order to seek life-saving interventions because of verbal abuse, because of physical abuse, because of emotional abuse, like misgendering, calling them by their previous names of their sex assigned at birth. Our community has not done enough to take care of these patients, and the care has always been there. And we should always strive to be proving to them that we can deliver the best care that we can to a cisgender person as we would a transgender person.
Okay. Well, I have a question for you. What recommendation would you give your colleagues, those that are in medical school, who are learning more and more about the barriers to care? What advice would you give when it comes to the transgender community and the trans broken arm syndrome?
Yeah. I think it's educating yourselves on the differences. So just for level setting here, I would say transgender people, there are some people who are assigned male at birth and transition to female and have top and bottom surgery, so genital surgery and also chest surgery. There are some transgender women who were assigned male at birth who just get top surgery and then don't get bottom surgery because of their own personal preferences, because of lack of access to care, whatever it may be. There are some transgender women who don't get top or bottom surgery, and they are still transgender women if their gender identity is woman. And by that logic, and this is going to drive some viewers crazy, I think, but this was something that once I accepted this, it made everything so much easier, is that some women have penises and some men have vaginas. And I know that goes against everything that we've been taught about humans through our medical education. Everything is so, there's a thin line, there's a very solid line between male and female within the medical education system and how we think about patients. It's usually the fourth word that comes out of our mouths when we're describing a patient to somebody, besides their age. And giving more nuance to the subject will just alleviate so much pressure that is placed on the members of this community of transgender and gender diverse people, because there's so much more about their identities than just what surgeries they have or haven't had and how that impacts your care.
Okay, well, Nick, thank you for that. And thank you for this interview. But before we go, I have a quote. I typically have a quote, and I'll ask you to respond. What does it mean to you?
Sure.
And my quote is taken from Star Wars, Clone Wars. Okay, and here's a quote. When destiny calls, the chosen has no choice. What does that mean to you?
Can you repeat it?
When destiny calls, the chosen has no choice.
Well, first of all, I don't know if you saw my Princess Leia in the background. I'm a huge Star Wars fan, so thank you for that question. This is maybe the best question I've ever received. I think it means once you are afforded a privilege of anything in life, especially being a medical provider, and you're also afforded the perspective to understand that you can wield the power that you are gifted to help somebody else, I think there's nothing else that you can do. That quote resonates with me, I think, ever since, and I'm still in my medical education, I'm still trying to negotiate what it means to me. But I know that this is something that I'm very passionate about, that is stuck very deeply within inside of me. And like your quote says, there's nothing else. I can't shake it. It's something that I will carry with me into my career as a physician. And I don't necessarily know what form that will take, but I know that I will continue to learn and grow with it.
Thank you. I know destiny has called you, and the choices that you have, your pathway is endless, and the choices that you have to move forward is also as endless. Well, thank you again, and I hope you have enjoyed this interview as well as the audience. I think this topic is very important, and for more information, they can go to msdc.org and look under WOW, W-H-O-W. Thanks again, Nick, and enjoy the rest of your day.
Thank you very much, Dr. Emanuel.
Bye.
Bye.